Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Dave Wessinger. He's a healthcare executive. Today's Kevin MD article is How to Adopt AI in Healthcare Responsibly. Dave, welcome to the show.
Thanks for having me.
All right, let's start by briefly sharing your story, then we'll jump right into your Kevin MD article.
Okay, I'll give you the short story for sure. I started, I go back almost 30 years now when I was just a young man with hair. And I was an IT guy working in a nursing home of all things, and recognized that there was an opportunity to improve care delivery and provide clinicians with solutions that were better than what was currently available in the on-prem type world, if people remember that. And just felt like, it was delivering software over the internet at the time, which we now call cloud, but that was a big differentiator at the time. We happened to leverage the technology and the first ones that came to market with that technology. And we've been doing that work ever since, working closely with customers, delivering really effective kind of system of record type solutions in the senior care space.
All right. And of course, AI, which we're going to talk about today, it's really rocking the healthcare market. So many solutions and startups are out there. For those that didn't get a chance to read your article, tell us what it's about.
Yeah, so I think there's a few things that I was trying to share to the community, and largely I think, and this is the way we think, is we've been through some things, we have some experiences, and gosh, we don't all have the opportunity to connect on those. So why don't we share some of the things to save other people some time? I think the one thing that resonates in that article, for those that haven't read it, is there's a lot more to AI than the acronym. And so as you think about, we talk about responsible AI, and I think people don't really give that enough time, but there are many different ways to it. And you have to be really thoughtful if you're not doing it yourself. Where is the data going? What does the access look like? What is security? How do you train the model? What's the efficacy? And all of those things will have an impact on your ability to be successful with it. And so that, among other things, with just sharing experiences, and largely I want to let people know that it is a journey. It takes time. Don't chase kind of AI, chase the value, if that's a thing, and don't get caught up in it. And so it has to land in real material value, and don't be scared of it. Lean into it. And if you feel like you're behind, you're like everybody else.
Tell us the type of specific AI-centric products that we're talking about now and that you're most familiar with.
Yeah, I guess that, where I think most of us, when AI really lands after you spend some time versus in a lab, is where we can truly augment the clinician in the loop and be helpful. And I think we all recognize that this industry is, the clinical administrative burden is very heavy, and we want to make it a great place to work again. And so as I think about where you have opportunities, I'll take one specifically in a product area that I'm excited about. For those close to healthcare, you recognize litigation is a big issue. And litigation often is related to how well you document. Almost times it doesn't matter what you actually did, it's how well you documented what you did. And do you have a trail to defend yourself? And it's a sad situation. But the reality is, if you use AI to move through charts, look for opportunities where either there's gaps in documentation or things missing near real time to help the clinician more effectively respond to what might have been a fall but wasn't captured that way. So they didn't inform the physician, didn't get the rails up, didn't kind of manage, communicate with family, all of the things. And you actually deliver really good care. And at the same time, you're protecting yourself from potential litigation, which makes your business more sustainable. And AI is a perfect, that's kind of what we've currently in our business have released to market, but it's well received in that it's very difficult to go through every chart for all of your patients or residents and understand what's happening and make sure you've closed off those gaps in real time to deliver great quality care. And so it's something that was just really hard to do. That is a perfect target for AI.
Now, you're talking specifically about the nursing home space, which of course you're
Sure.
familiar with. Give us a scenario, a before and after. What is though that documentation like now or before AI, and give us an example of how AI can really fill in those gaps, just to illustrate your point.
Yeah, so there's a couple ones. Actually, I might even jump to another one, resident status. So you probably recognize that in situations, there are times where you're with a patient, and as you reconnect with them, being a physician, a CNA, an RN, you want to understand what is the current status. And if you want to do that across the shift you happen to be on, that's combing through a lot of information or shift notes and can be challenging. And so AI can surface that very quickly and give you the quick kind of dot jot format of what has happened, so I can quickly get up to speed with that individual in a moment.
Mhm.
that otherwise would have taken hours. And so you're way more informed to provide the right level of care and the right interaction with an individual, given the information that you didn't have to scour for, that is appropriate and available in the moment, which is also, we leverage that same capability for reason for transfer. Oftentimes, when somebody shows up in the ER, it's
Mhm.
very difficult to figure out why they're there. So to take what we think is helpful as a 250-page CCD, but the reality is you want to turn that into actionable information that somebody can ingest and know how to treat and manage and work with the individual, which is where AI has landed really well.
So you're saying that AI can take 250-page document of a patient's chart, synthesize it, summarize it, so whenever they have that transfer of care in the emergency department, for instance, it'll just surface the most actionable, essential information.
Exactly right.
How accurate do you think AI is currently in its iteration in terms of doing things that we're talking about?
Really good question. I think that's the trick in getting it right. What we've seen as an example is the efficacy in models where we're using, call it natural language processing of clinical data versus standardized documentation that's codified. There's a significant difference in our ability to demonstrate or share kind of information that is helpful versus might hallucinate or might not be accurate. And so what we've been pushing for is, as much as we want to make it as easy as possible at documentation in, the more structure we have around that, the more effective they're going to benefit from the actionable intelligence that comes out of the AI models. So what goes in really matters. And the poorer it goes in, the less effective the models are. Most models have an opportunity to land well. I think the challenge, quite frankly, is in healthcare, you can't be half right. You can't be close enough.
Yeah.
You know, one medication error is not acceptable. And so the bar is much higher in healthcare. And so I would say there are a number of use cases that will land, but it does take time for them to mature. And there are some things that the model can't do, which is getting better information to it.
So we are speaking in mid-December. This episode probably won't be published until mid-January. So with the current models, which I know they iterate and they evolve so quickly, if I dump 200 pages in and whatever comes out, how confident should I be today in terms of what AI can synthesize from that 200-page chart?
I think it's a really good question. I would tell you as a technician that you should be extremely confident in what comes in relative to what you could do as a human. I think you'd be very confident. I think what's interesting though is, we have to spend some time and iterate through it and build trust ourselves as clinicians. And I say that because we've seen situations where we've been able to demonstrate and share with to a model that's, call it, 99.9% effective in terms of what the outcome would be, to the point where it requires clinical verification. And it's so common and they trust it so much, they often don't even look anymore. And in fact, are causing more errors than they did before because it's so fast and so accurate.
Mhm.
But that 0.5% is a big problem. And so it's a very tricky question to talk about. I think we're going to get most of the way there. I think we're going to operate as well or better than humans in the stuff that they just can't do as well, which is ingesting information and summarizing it. But there's going to be some things lost along the way as we create some of those efficiencies. And so it's going to take a little bit of time to get perfectly accurate. I think that's, if you chase perfect, you're probably not going to get there. But I think month over month, year over year, the models will get smarter. They'll learn from how humans interpret that, and they'll get better from, if your model is learning from human behavior, you'll be better off than kind of a static model.
Now, as AI infiltrates workflows in pretty much every area, we always talk about the new definition of the human in the loop. So, in the scenarios that you're mentioning, where is the physician, clinician, or human in the loop as this whole process iterates as AI evolves?
It's very clearly that as you make decisions, you can surface information that they then need to interpret and take action. And so it's not a medical device. It's not there to tell you what to do. It's not there to treat patients. It's there to provide information in a faster way than a human can ingest so that you can do more with less. And so I take a great example as intake. So you have patients coming to you and you want to understand, can you be effective with that patient? And generally speaking, if they have the payer mix and they really understand their financial profile and their clinical capability and what they're able to provide, they can make a decision fairly quickly. And oftentimes that's human based and takes time. There's avoidable days that get piled up in the system cost. 95% of that is automated.
Mm-hmm.
Yes, I can take them. No, I can't. And somewhere in the middle is where this isn't even clinician in the loop, this is human in the loop of automating a process that's largely outside of a clinical process, which I think are easier than creating that automation in a clinical process, because you do need clinician in the loop. That's just not optional today. And I actually think the clinician, interesting enough, is AI proof in terms of the future.
Hmm.
The administrative folks think, that's going to move a little faster. And so because there's less risk, you're starting to see that automation. So the human in the loop is there's a gray zone where, can we take this patient? Do we have enough information to know our contracts well enough to say we will get paid for a bariatric bed, or we will get some of these exceptions and not find ourselves in the red on this patient, or we'll be able to manage, deliver the proper care and do well as a business. And so that's where you have a human kind of deciding between the gray. And more it could be 10% today, and over time you'll see it go to 5 and then 2 and then 1. And so what happens is, and what I'm really excited about is, all of these folks that AI is hitting will move to higher value work.
Hmm.
The last person I talked to that loves kind of entering data into a system, well, I can't remember when the last time that was, quite frankly. So that'd be the first time. And so getting to a different level, and I think we've seen that through history, that's just better. That's just better for all of us.
Now, for those two scenarios that you mentioned, decreasing litigation, but because AI fills in administrative gaps and perhaps synthesizing information for transfer of care, do we have outcomes data in terms of really reducing litigation or improving patient outcomes, or are we too early in the process?
I'd love to tell you I have a great answer for you on that. It's crystal clear that we see significant advantages, and we've identified in many cases, 90% of the incidents aren't documented effectively. So simply surfing that information, taking an approach, resolving those and working towards them will invariably have a meaningful impact. But that impact won't be felt for years, because
Mm,
litigation takes a long time. So 2 years from now, I'll come back in your podcast and talk about the actual impact. But we all see the value there in terms of the impact they can have to their business, and quite frankly, the patient outcomes, which is why we're all doing this. And so it'll take a little time for it to hit, but the expectation is they should be able to meaningfully reduce that risk to their business. And so when I think about AI, Kevin, I really think about, can you affect the bottom line? And typically in healthcare for the last 25 years, we really haven't. We've done a lot of work as system of records to digitize information, but we haven't really materially changed how we work with it. AI is going to meaningfully change that over time. And so when you think about those workflows or the opportunities, we now have an ability to say, actually, we can do better with the FTEs we have. In certain areas, you can put them into different jobs, and no one likes to talk about, we might be able to reduce the FTEs. Certainly on the clinical side, we're kind of, we have staffing shortages, but to be more effective. And so I think there's opportunity in the efficiency side. I think on the compliance and quality side, and then I think even on the revenue side. And it's not about anything more than understanding the care you're providing, and making sure that you're coding it appropriately to get paid what you deserve. And that's kind of it. I think there's opportunities in all of those areas that we're trending towards with AI, in terms of where can we be helpful, largely on the administrative side, and working clinically carefully and thoughtfully and responsibly.
So let's zoom out a little bit. And for those healthcare listeners listening to you on this podcast and they're inundated with all these AI related solutions, tell us the type of questions they should be asking to determine whether it's right for them and perhaps anticipate some of the potential risks that these tools may bring.
Well, I'll use a great analogy before you, as a thought-provoking kind of analogy here. I was out buying a putter the other day, and there was a putter on the shelf that was an AI putter. Like, interesting. Are you really going to figure out how to make me putt better on this like physical thing that doesn't change? And so I think, be careful of the marketing aspect of AI. And then I'll kind of move forward and say, the things I would look for are, what are you delivering to my company in terms of value? Every board, every organization, everybody I talk to is all about AI first, AI. And it's more about moving on that, moving it fast. So I would be, as opposed to, what is the value you're going to bring to the business?
Mhm.
It's like, okay, once you get past the value side of it, what does it really mean? Is it affordable? And then the next part is the due diligence under, okay, talk to me about your company. Where does the data go? What's your kind of pledge to responsible AI? How do you think about building it? Where is your infrastructure? Where does my data go? And another analogy is, we all have Gmail accounts, and we know what it's like when that leaks out. Next thing you know, you have an ad for the thing you
Mhm.
just sent an email about. Well, that is happening. Data is king. And so as that gets into and potentially the wrong hands, you're giving out accounts, you're letting them come in. What they have access to and what they do and where that data goes is really important. And it could do more harm than good. And so you really have to look under the hood. And there's lots of ways to evaluate AI, but you need to get educated on not just the value it brings, but how is it delivering that value? And is there anything under the hood that you should be concerned about? And you kind of need to be educated there or get some help. It's not something that, because there's lots of vendors coming to the table with some solution, it's really important to just understand their infrastructure. Is it in the country? And all like the little things like that, I know seem small, but who they use as a partner, where it goes, all really matter. So it's a little bit of everything, but be curious, focus on the value, not AI. That's interesting, but that's not what you're really doing it for. It's a technology that allows us to deliver more value. And I would say this, I believe in the next 2 years, we, as general kind of software people, will deliver more real value to customers, especially in healthcare, than we have in the last 25 years.
We're talking to Dave Wessinger. He's a healthcare executive. Today's Kevin MD article is How to Adopt AI in Healthcare Responsibly. Dave, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Well, I think, be curious. That's number one. Don't be afraid. It's it's easy to kind of jump into it or kind of hold off, but I think it's engage, learn. You don't have a lot of time to evaluate 50 products. We're all really busy. That's clear. Word of mouth is really helpful. And, sometimes going slower is faster. The ones on the bleeding edge bleed. The ones that kind of, are on the kind of the next frontier tend to do better. And so, you have to get up to speed on your diligence, look for where it's actually working, ask the right questions, and be okay to try some things. And it's not about a full commitment. If there's a way for you to learn and try a pilot, it's not a terrible idea. Sometimes those are kind of hard, but if it's going to deliver that kind of value, you could probably find it fairly quickly. And if it does, then that's the kind of thing you can lean into a little bit more. So I think just don't be overwhelmed by it. Take the time to learn. No questions are dumb questions. We're all learning. We're all on that journey. In a month from now, you look back and think that question is kind of silly, but it's just the pace at which we're moving. There is no pattern. There is no kind of booklet. Those are coming, but we're all learning at the same time. And I would say just be curious, look for the opportunities, and specifically look for the areas that will have the biggest impact your business, because we've tried this, 70 AI vendors in our business, probably two are delivering value, and it's a lot of money out the door. And so you don't have that. They probably don't have that opportunity. And so I would say pick the things that will add value, validate it, spend some time on it, and don't be afraid of it.
Dave, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you.